Namaste and Siddhi Pranam. Welcome to your today's topic, which is role of a prenatal yoga teacher and guidelines for prenatal yoga. We are going to discuss your role as a teacher and important guidelines that are required to be practiced while teaching prenatal yoga. It also includes all the contraindications and the medical conditions that pregnant women can go through. So try to watch this couple of times prior teaching. Also, you can read the same portion in the manual to deepen your understanding. This will help you stay informed and equipped with the kind of conditions the mother can go through during pregnancy and really help you understand their journey, especially from a medical perspective. So let's dive deep into your role as a prenatal yoga teacher. So as a teacher, you have a very unique and important role in supporting the mothers in their pregnancy journey. You understand how important role prenatal yoga plays in the journey of a mother and what are the core benefits of practicing the yoga. And you really understand that this passes on to the generations. The way mother is going to go through this journey, how powerfully she goes through it with lots of calmness and ease, the more kindness, compassion she practices through the journey, all is going to be transmitted to the upcoming generation. Since you as a teacher realize the value of it, it's important to create that safe environment for mothers such that they feel that you have a very, very welcoming environment regardless of their previous background into yoga, whether they have practiced it or not before. So it's important to convey those benefits and understand the fact that every woman that you're going to support and you're going to open your doors to welcome into your space and share these teachings are going to be benefited, and their generations after them are going to be benefited through this practice. So staying without any kind of judgments for the mother and having a very open heart to welcome them and creating that loving and safe environment for them is very, very crucial role that you're going to play as a prenatal yoga teacher. And this also means that you're going to create that personal connect with all the mothers to understand their individual conditions and also modify their poses and accommodate any physical changes and limitations that is occurring in their pregnancy journey, as well as also recognize and address any concerns or discomfort that may arise during the class specifically. And in addition to kind of creating a safe environment, it's also important that you educate your students or the mothers constantly about the benefit so that it stays in their mind how crucial it is to keep on practicing, to keep including all the kind of practices in their pregnancy journey, and how important is it to have consistency in the practice. And also at the same time, this will help you to communicate more in depth. If you take out some time to share the benefits and everything, and maybe take a few minutes after the class or before the class to create that personal connect, that will help you to communicate better with mothers, and hence they will be open to share their pregnancy journey with you, specifically any medical conditions that they might have. And it's important to communicate to them that they should be responsibly sharing any kind of medical changes that is occurring in their journey, and they should be very, very clearly and openly sharing that with you as a teacher. So it's important to create that communicative environment where they're free to share that with you. And another key aspect is to help your student have a strong connection with your breath and body. Pregnancy can really bring about many physical and emotional changes, and learning to breathe deeply and stay present can really help the mothers to stay grounded and centered throughout their practice. And this also comes to the point that it's extremely important that you as a teacher always encouraging the mothers to listen to their body and honor their limitations. It's only possible when you are not unnecessarily ever pushing them to come into asana or master a pose, that this is not the time to do that. It's the time to honor their body, listen to their discomforts, understand their body, and focus on their breath. Focusing on the breath will also develop greater awareness and deeper connection to their growing baby. And this awareness will help them stay mindful during the rest of the day also. So in addition to the physical and emotional support that you're going to provide to the mothers, you can also play a very important role in helping the mothers to prepare for the childbirth, which is a very, very crucial and critical stage of the whole pregnancy journey. If you're going to step up and guide the mothers to prepare them to go through that fear of childbirth and really mentally prepare them, emotionally prepare them, this you can obviously do through your support, your way of communication, the safe space that you provide, but also at the same time with guiding them constantly and preparing their bodies constantly to the childbirth, for the childbirth, and guiding them what asanas they can use even during the labor times when it's possible they may or may not be practicing yoga at that time, but you can always guide them in advance what asanas can help them open the pelvic area and what kind of breathing they should be doing at the labor stage, or relaxation techniques they can use from yoga or yoga nidra they can practice and visualize greater outcomes in the pregnancy journey. So all of this you can help mothers, and through this they will feel certainly more confident and empowered to go through the childbirth journey. Next is it's important that as prenatal yoga teachers you stay informed and up to date on any latest research or best practices that are happening inside prenatal yoga. We will keep informing you or updating our course also, and we'll update you whenever that happens, but we are going to give you quite a lot of information and understanding of pregnancy journey and the condition during this course itself, that you will be well equipped. But still, you can always enhance your understanding and knowledge by reading more books. So reading more books, not from a technical perspective, but maybe those books that really help you connect more deeply to the journey of a pregnant mother. And the more you know and understand their condition, the better comfort you will be able to create for the mothers. And so in short, or just summarizing everything, I would just say that as a teacher, you have an opportunity to make a significant impact on the lives of the mothers and their babies. So by creating a safe space, being supportive and educating yourself and creating a communicative environment for mothers and helping them connect to their breath and body more deeply and helping them to prepare for childbirth, all of this will really have a great positive impact on the journey of the mothers, and they will be empowered to go through this journey of pregnancy and childbirth. So I would just say, just be patient, attentive, have knowledge with you, and always be supportive of the mothers who are going to take your class. Just stay open, communicative, have a kind heart, and welcoming heart, I would say, all the time for the mother. So now let's discuss the key guidelines for prenatal yoga practice that you should keep in mind while teaching. So let's first take a look at the most basic guidelines that should be kept in mind at all times. First and foremost, emphasize safety. The most important principle of teaching prenatal yoga is to ensure that the safety of both the mother and the baby is quite crucial to the entire process or the class, I would say. So that should be on top of your mind all the time whenever you're teaching the class. So avoid any asanas that involve compression, strain, or overstretching of the belly at any point in time. The next is to adapt poses, which is very important as well. Since pregnancy is not a time to learn new or more difficult or advanced asanas, so asanas should actually be adapted to suit the needs of the mothers and should work on creating a sense of openness and more space in their bodies such that they feel more calmer and comfortable in each asanas. So anywhere where the body is being shrinked or they're not feeling comfortable, they should be instructed to come out of the pose very gently but immediately. Now next thing is overstretching, avoiding that completely. So due to the increase of relaxation, which there is a hormone called relaxin which releases in the body during the time of pregnancy, which actually softens the muscles and ligaments. So overstretching can be more common during pregnancy because mothers just wouldn't know that they're overstretching. So just reminding them that to be careful while stretching is very, very important. So you can also avoid very strong twists and anything that contracts the abdominal area. Also, the movement has to be very, very gentle. Even they are going into the asana or coming out of it, making sure that everything, the transitions are smooth and slow, and the twists, if that requires slight twist, any asanas are done very, very carefully and slowly. That should also be kept in mind all the time. Limiting back bends, that's fourth point and very important one. So avoid strong back bends and practice only very gentle ones. And as the pregnancy will progress, the lower back may curve more and more. So it is important to even be more careful while practicing back bend, specifically in the later trimesters when the curve is getting deeper and deeper. So back bending should be avoided, specifically in the last 2 trimesters. Next is protecting the pelvic area, especially in the first trimester. So in addition to avoiding any prone positions in the second trimester and the first trimester, it's important to avoid prone positions because of breast tenderness at this point in time. So this will help the mother to have any fear of any accidents, specifically in the first trimester where miscarriages are common. So that should be taken care well while suggesting any hip opening asanas or where squatting is to be done. So that should be done very slightly or not too much in the first trimester specifically. The next is avoiding lying down on the back. Specifically, this is more important for second trimester. They can also, you can actually suggest women if they don't feel too comfortable lying down on their backs, even in the first trimester, it's fine. They can lie down on their side. And in the second trimester specifically, if they continue to lie down on their back, it can feel uncomfortable, or it can cause dizziness or faintness. That is due to compression of the vena cava nerve, which is the main nerve that returns the blood from the lower extremities and abdomen to the heart. So pressure on the vena cava decreases the oxygen supply to the mother and the baby. That is why it is recommended to avoid lying on the back completely after 6 weeks of pregnancy. So you should always remember this, because it's a very serious thing that a small thing as small as lying down on the back can create a lot of discomfort for the baby, especially if done for longer periods. The next thing is limiting inversions. So avoiding inversions due to the possible pressure again on the vena cava nerve. That is because it can again result into any dizziness or discomfort. This is especially important in the last 2 months when the baby is preparing for the birth and getting into the position. So there are asanas which has not full inversions but partial inversions. So even those partial inversions should be avoided in the last 2 months, because we want the baby to settle downwards and you don't have to do any movements which motivates the baby to come upwards. Last and the most important point is limiting extended holds. So avoiding holding positions for extended periods of time, particularly standing poses that can be more strenuous, or for the women especially with high blood pressure, the pulse rate can increase very high and the heart can work very fast and harder than the normal. So it is important to avoid overexerting also. It's just not just for women with any particular condition, but for in general also, overexertion should be avoided at all time. And the goal of a yoga class should be to achieve more relaxation and calmness rather than to exert them in any manner. Next point is moving slowly. So taking extra care when moving from supine to sitting or standing positions to shifting positions, and always doing it very, very slowly. After doing supine asana, it's also recommended that the mothers roll from the side, ideally from the left side, and then slowly sit up and come into a sitting position. The details the guidelines on each asana is guided in your asana videos, but still this is in general that this applies to almost every asana, that sitting up and coming back from asanas should be done very, very slowly and always coming up from the left hand side. The next point is listening to the body. Constantly communicating this during the class is a very, very crucial point that you need to take care. So release any pose that just doesn't feel right. Let them know. If you feel breathless, please come out of the asana. If you feel that your heart rate is increasing, please come out of the asana. So all these instructions will really help the mothers to know when to come out of the asana immediately, and what they should keep an eye on when they're not feeling comfortable about something. And that remember that each woman will have different body, different condition, and every pregnancy is also different for that matter. So just guiding during every asana that how important it is to keep listening to their bodies is very, very crucial. And then comes the individual approach. It's important that you make the mother understand that prenatal yoga is about respect and love for herself and the baby. And each mother is unique, and it's important that approach to each student from your side is also very personalized and individual approach. So if you understand this, you will also guide the mothers to understand their unique bodies and always understand that what the mother next to her is going through may not necessarily be the case for her. And so really understand her body and be able to communicate that to you so that you can have a personalized approach for her. So that this communication and your personalized help will always go hand in hand. So in short, as prenatal yoga teachers, you should prioritize the health and well-being of the unborn baby and the mother at the same time, and be aware of the unique nature of each pregnancy. Focus on building strength and stability in a safe and effective manner, and prioritize also on the mental health and stress management. And by incorporating these guidelines into your teaching, you can help ensure a very healthy and positive pregnancy experience for your students. So let's now discuss important points to remember as a prenatal yoga teacher. So first and foremost is baby's health. Baby's health is foremost priority, and it is of utmost importance at all times. So that should be kept in mind while teaching. And you must prioritize safety of the baby at all times, teaching all asanas while keeping this in mind. This means being cautious and mindful of any poses that may put undue pressure on the uterus or put the mother into any kind of overexertion or any high impact movements that could possibly harm the baby in any manner. So you should also be aware of different stages of pregnancy and how it's impacting the mother's physical and emotional health and well-being. So for example, specifically second trimester, during the first trimester, the uterus is still small and delicate, and it's important to avoid any poses that put pressure on the uterus. So during the second trimester, the uterus expands, and it's important to avoid any poses that put pressure on abdominal muscles. And during third trimester, the mother's center of gravity shifts, and it's important to avoid poses that could result in any balancing issues. So being informed of different stages will really help you suggest and guide better asanas as per the stages the mothers are going through. Modifying poses to ensure baby's comfort is also critical. For example, the woman is lying down on the back during the second and the third trimester. This can put pressure on the vena cava, as discussed before. So all this, keeping in mind always her trimester, her stage, will really help you guide her through her journey. And not just guide her, but also help her for few asanas and practices that she can possibly do with the help of broth. So if you are aware that what stage of pregnancy she are in, you can actually modify her asanas with help of blankets or bolsters to support her back at times, or put it under her head, or there are different props that can be used for helping the mother during a different position, which is guided in the specific asana videos for each asana. But just being mindful of the stage will really help. Also, you can incorporate very, let's say, subtle movements and controlling the stretches and using deep breathing can really help promote relaxation in the body and also reducing stress that is being collected in the body during the time of going through the pregnancy days. You should also encourage that it's really important if the mother is feeling any fatigue, any overexertion, then she should not push herself, and because this can negatively impact her health. And communicating that is also a very crucial point at all point in times. Next point is about second pregnancy. So just know that second pregnancy is different from the first. So while second pregnancy can be just as magical as the special first one, but it can also be very different in many ways. So it's important that as teachers you understand these differences and can make appropriate modification for each student during their second pregnancy. The physical changes are one of the most significant differences between first and the second pregnancy. So in the first pregnancy, woman's body is not used to the physical changes and the strain that comes with the pregnancy. However, in the second pregnancy, the body is already familiar with the changes that so hence the body may react differently in the second pregnancy. For example, a woman may experience more aches and pains in her back or pelvis during the second pregnancy, or she may feel more fatigued earlier in the pregnancy. So as yoga teachers, you should be aware of these physical differences and offer modifications that take into consideration any discomfort a student may be experiencing. Also, emotional changes can also be a little different during the second pregnancy. So in the first pregnancy, a woman often is filled with excitement and wonder as she prepares for the child and to have her first child. However, in the second pregnancy, she may have mixed emotions of excitement and also nervousness about how new baby will interact with the first child, or how their bond is going to be, or any other children that she might have already. And so also there can be other concerns, that whether if she's ready to have another child or not, especially if it's not a planned pregnancy. So there can be many situations here. And it's important as teachers that you should be sensitive to these emotional changes and offer any supportive and calming environment that she might require during this stage. And also, second pregnancy may impact a woman's physical ability to participate in yoga. For example, if she have had any difficult delivery in her first child and she has been through some medical situations and she has any physical restrictions or limitations during her second pregnancy because of the impact of the first pregnancy that she's still dealing with, all that. So having information on that and being able to communicate that is very crucial and important. And being able to modify the practices in accordance to the required comfort for the mother is very important. Next is that keeping in mind that second pregnancy can also bring a lot of responsibility for the mother since she already has a child. And this increased stress will add on to her a lot of anxiety and fatigue, because she's already tired if she has a younger child previously, of course, and there is less gap between two children, then that can be very, very exhausting on her pregnant body. So this can impact her ability to do strainful physical asanas too much. So as teachers, you should understand that what a mother is into which stage and which kind of pregnancy stage, and if she has the support or not, and how often she's feeling tired and everything. So all of this will really help you offer any modification, or maybe some women just need to lie down in a yoga class someday and not to push anyone beyond their limits, or what kind of a day they are having in a particular day. So they might just listen to a yoga nidra or just do relaxation or breathing some point in time in one class, and it's really fine, because you should understand that how their day has been, or how tired or exhausted they are feeling in the moment. And this will allow her to really participate at her own pace in the class. Next is about strong abdominal muscles for fast recovery. So as teacher, you should understand that helping mothers build strength in a safe and effective manner is a greater role that you have to play as teachers. So from one stance, if we see, it's important to understand her discomfort, but at the same time, our goal is also to build her strength and prepare her for managing the child effectively, since her body is going to go through a lot of toll while even she has given the birth. And yoga is actually an excellent way to strengthen the abdominal muscles and improve overall physical fitness, as it focuses on building strength and flexibility and balance. So since this is not the time where we can do a lot of planks or very difficult asanas which put too much pressure on the abdomen, but still we can do bridges or side planks a little bit while putting one leg on the ground. So slight abdominal exercises can be done, wherein it also helps not just with building abdominal muscle, but also helps with strengthening arms and other body parts as well. So just know that having a strong abdominal muscle will significantly help the mother to have faster recovery post-delivery. And also during pregnancy, the abdominal muscles are stretched to accommodate the growing uterus, and they may weaken over time. So practicing certain asanas during pregnancy which supports the abdominal health is going to be very beneficial for her overall journey. And childbirth particularly can put a lot of strain on the abdominal muscles, so making them sore and weak and leading to all the discomforts and difficulty in doing everyday tasks. So therefore, if you help them build the abdominal muscles prior to the delivery, it can really help them prepare their body for the physical demand of childbirth and also the postpartum period. And the strong muscle will also support their back and pelvis, leading to improved posture, reduced discomfort, and any strain that they might have on the other muscles as well. And also, after the baby is born, there's a lot of lifting that happens, whether they're carrying the baby or the stuff and all that. So this can put a lot of strain on their muscles. So if they have some strength in their abdominal muscles, this can really help them in their mothering journey as well. So once again, keeping in mind the stage of pregnancy, Just pressing this upon once again is an important point also, and by doing so you'll ensure any safety and all the kind of comforts that a mother may require at a particular stage or a particular day even. So knowing that will be really, really helpful. And specifically, the more you are aware of the conditions of different trimesters, that is going to really help the mothers further. For example, like the first trimester, women might experience a lot of fatigue, nausea, hormonal changes, and it might be challenging for her to maintain any usual yoga routine. So you can offer maybe home classes or online classes, or just give her yoga nidra or breathing practices if she has too much nausea. Some women has nausea like constantly until like 4th or 5th month also. So really, really depend on the condition she has. But whenever she feels even a little better, if you can just give her small practices to continue on her journey of yoga during the pregnancy, that can be really, really helpful. And let's say in second trimester, most women starts to actually feel energetic and comfortable since the baby's growth is there and it's happening, and body's adjusted a little bit and with the new environment, and the baby is also on the stage of growth. So at this point in time, where the belly is not too heavy yet, as well as there is energy that has arisen after completing the first trimester, this time you can really use to strengthen the mother and the muscles that she needs to strengthen for labor and delivery. So you can actually use the second trimester per se to really, really help them build their practice during this phase. And once the women enter into third trimester, their body can does go through further changes, and including like there's a lot of weight increase that has happened during the third trimester. The weight gain is very, very rapid. The center of gravity also shifts, so there's also a lot of pressure on their bladder and lungs at this point in time. So the entire anatomy is actually very, very different than the way it was at the beginning of the pregnancy. So as teachers, you should be able to really know what kind of poses to be avoided that put pressure on the uterus and the bladder, especially, and the internal organ, especially in the third trimester. So understanding the shifts in the anatomy during the third trimester would really make you understand that what is the current stage of the body the mother is carrying. So instead of really focusing on asanas, third trimester is really time to focus on more relaxation practices and breathing practices, and just preparing the body for labor and delivery. And in addition to that, if you understand hormonal releases at different stages of the pregnancy, that will also help you understand that, for example, the hormone relaxin increases in the woman's body during the pregnancy phase. That makes her joints more flexible. So that also increases the risk of injury. So constantly knowing for the students that they should not be over pushing at any point in time. So if you notice at any point in time in the class they are over pushing themselves, just guide them not to do so, because the higher is the risk of injury at this point in time. And that's it. Like, it's important that they should not read too much from Google and really rely on the fact that you are a qualified teacher. And since we are in a digital age and all the information is kind of available at touch of a button, so it's important that that mother can always refer to internet as a valuable resource, but you can remind them that it's important that they discuss their issues with you also, and so that you can guide them properly as a qualified teacher. So just letting them know this once is very, very important. And next is really keeping in mind that you personally have done a lot of effort in completing this course, and you have given your best shot in understanding the anatomy and physiology and the mental health status of a pregnant woman. So just having confidence upon yourself to really know that you're qualified enough to guide the mothers at each stage, and letting them know that you understand the physiology and anatomy, the emotional and mental state of the mother. So just creating that trust for yourself is also very important and crucial aspect, such that mothers can really confidently come to you. You can even give example to a woman. Let's say a woman has a history of a preterm labor, or any other medical condition during the pregnancy, and she chooses to watch a video online and practice all those asanas that were there in the prenatal yoga video. So it may or may not be suited for her given her medical condition. So just explaining that to students is very important, that you should not be fully relying on online resources for performing asanas specifically, because it can be harmful to the baby at times. And online resources or videos can actually vary very greatly, and they may or may not consider the particular body situation a mother is in. And that's why communicating the fact that you are expert in the matter and you know what's going on and you are in the perfect position to guide the mother is really important as well. Next is keeping in mind that the mother's mental health directly affects the unborn baby's health. So health issues such as anxiety, depression, stress can have a significant impact on the health of mother and the baby as well. So you can play a vital role here by offering emotional support to mothers at any point in time, just creating that trust once again that they can speak to you, and be aware of the fact that that if it's too much, her mental health is taking too much toll, then when is the right time to even guide her to use professional help. And also that when a mother experiences stress and anxiety or depression, her body releases cortisol, which is a stress hormone, which can actually pass across the placenta and affect the developing fetus. So you know this, and you should actually communicate to this that how important it's for a mother to take care of her mental and emotional health at all point in time, because any stress that she goes through, the baby is going to go through that, and this can lead to a lot of negative impacts on baby's brain development, and also even risk of preterm birth or low birth weight or behavioral issues in the baby. And additionally, a mother's mental state can also impact her ability to make healthy lifestyle choices, such as eating nutritious diet, or getting adequate exercise, or doing proper yoga, or seeking prenatal care at the right time. And so as a teacher, you can prioritize all these emotional concerns or mental well-being concerns that a mother also has. And by communicating this, you can create that positive support for her and create that stress-free environment where she finds at least have someone, one person she can rely upon and is standing in a complete position to support her. And there is no mixed roles. She understands if you're there, you have a stand for her life to support her in all manners. So you can also use different tools to help her manage her stress, and based on her situation, you can keep guiding her to use deep breathing practices, different pranayamas, different visualization practices, mindfulness meditation practices, different meditations for different aspects of the pregnancy, or yoga nidra. You can use all those tools to really help her deal with the stress, and you can teach her to manage stress and reduce any complications for the pregnancy or any impact on the unborn baby. You can also constantly guide her to keep connecting to her body so that she understands the issue and she is aware of the fact that she's going into extra stress, which is harmful for the baby. So being aware is very, very important. So only if she's willing to talk and share, that's the only way that you can even help her. So first stage of that will be being self-aware of the increasing stress, and then second would be to be able to share that with you. And especially there are women who struggle with body image issues, might also have a lot of difficulty accepting the fact that their body is changing like this. And so encouraging the mothers or the women like that to be focused on the positive aspect of their pregnancy, that what a new life is going to bring to their life, and focusing on the fact that they're nurturing life and what it takes to nurture a new life, and what a great job it is, and if in the process it requires some sacrifices on the front of the body, it's fine, because you are carrying a new life altogether. It's not less than a miracle. So all those things are for different situations, can be guided to the mothers, and always supporting them with the guidance of healthy lifestyle, healthy diet, nutrition and sleep, and focusing on any complication or any kind of things that are bothering them, any discomfort. All of this is creating that self-awareness environment for them would be really, really helpful. So just keep these points in mind, and we will dive deeper into more detailed medical conditions and contraindications and specific pregnancy conditions in the next chapter. So see you there.